Welcome back to From the Frontline Surgeons' Voices for the American College of Surgeons Bulletin Brief. My friend and fellow regent, Dr. Ken Sharp from Vanderbilt. Welcome, Ken.
Well, thanks, Steve. I'm happy to be here.
Well, glad to have you back, this time talking about two different topics, both related to the virtual annual clinical congress, as you have behind you, showing October 3rd to 7th. One question that I'd like to start with are the hot topics. This is a theme that I gather you started some years back, and perhaps you could tell us about the evolution of hot topics and what's planned for hot topics this year.
So, Steve, we've had this session's going since 2013. Dr. Sachdeva asked me to develop a program back in 2012 that we thought might hold the audience in town for the Thursday morning, which was typically when attendance fell off pretty significantly. So Dr. Chris Ellis and I were charged with developing 10 hot topics in general surgery. And at our first session in 2013, we had over 1,100 attendees in the audience. And it really did become very popular. So we've made it an annual program. And because of that popularity, we've expanded it now to where we have 10 hot topics in surgical oncology, 10 hot topics in critical care, 10 hot topics in patient safety that we've used at various times. This year, it's only going to be 6 hot topics because of the time constraints with the change in the sessions to 1 hour. But it's been a really popular interactive session. The speakers only get 6 minutes, so they have to very tightly control their talk, and then they have audience questioning. This year, we'll have to do a little bit different question and answer session. But it's been a very popular topic among practicing surgeons.
Are you at liberty to give us a bit of a preview on what some of the hottest of the hot are?
Well, let's see. We have Dr. Stan Ashley talking about robotic inguinal hernia surgery. Is it good for the patient? Is it good for the hospital? Dean Makami from Honolulu is going to talk about the use of stenting in gastrointestinal anastomotic leaks. Amy Hildreth is going to talk about traumatic brain injuries and the need for reversal of anticoagulation. Dr. Carrie Sims from The Ohio State University is going to talk about intimate partner violence. Let's see, we've got Dan Dent talking about controversial aspects of appendicitis. And then finally, we have Dr. Ben Paulus talking about the role of subtotal cholecystectomy. So we've really tried to hit good, broad, general surgical topics.
Seems like you've absolutely succeeded. Great speakers, great topics, and a wonderful range of topics as well. Let's shift gears for a moment. During our last From the Frontlines interview, we spoke about the Herculean undertaking for which you volunteered yourself to become the expert on all of the non-surgical aspects as well as the surgical aspects of COVID-19. That, of course, parlays into the program. Here we are in August of 2020, looking at a program 2 months away, which for all intents and purposes was planned back in August through October of 2019 before anybody had heard of COVID-19. How did the program committee pivot to accommodate this very important topic, and what can we expect to see on the program related to COVID-19?
Well, first, our dramatic charge was to change our in-person meeting into a virtual meeting, which has been as you said, a Herculean effort of a different type from our staff and from our faculty who'll be presenting there. As far as developing material pertinent to the COVID epidemic, we had several volunteer submissions and several targeted submissions that we asked for. We tried not to make this a COVID Congress. We were very cognizant of the possibility of COVID fatigue. So we have actually 6 sessions, one of which is 2 1-hour sessions, but we're covering probably the most important one is Dr. Lena Napolitano from the University of Michigan has a 2-hour session, one on the respiratory and pulmonary support issues for COVID, and then second on another hour on critical care support of the COVID-19 patient. Because as you're aware, the ventilator management changed dramatically for these patients with ARDS, with COVID, and then there are other critical care issues in terms of anticoagulation. So I think it'll be a superb session for those people who want to hear about the most recent developments in the critical care management of COVID-19. We also have sessions. One is from an international perspective. We have some international presenters who are going to talk about how COVID affected their surgical practices. We have the Academy of Master Surgeon Educators is going to have a special session at noon on Monday of the college, where they talk about the impact that they've had of COVID on surgical training, which has been really impactful. We have some leadership and communication sessions that were developed during the COVID crisis. And then we also have a session on well-being and how that was brought to the forefront with COVID fatigue during the apex of the pandemic. So we have 6 really good sessions, I think, and people will pick and choose which ones are most important to them.
And I suppose one of the advantages of the virtual Congress is people can go back and look at the other sessions at a later date as they'll be archived. And of course, another advantage is the price is right in that it's free.
Can't beat the price. But yes, it's right now our understanding is that all the sessions will be available until the end of December for free. So I think that's pretty exciting. I'm gonna end this by predicting we're gonna have the highest registration by far for Clinical Congress that we have ever had in our history. The international attendees are very excited about the affordability here, their needs to avoid travel. I think it's going to be a stupendous registration.
I think so too. I agree with your clairvoyant prediction. But I think it's not just the convenience and the price. From what you've just told us, it's also the content. A fantastic, fantastic program. Congratulations, and thanks for helping put it together.
Well, the program committee spends an extremely intense number of calls and sessions, really very pointedly trying to make the content pertinent to the practicing surgeons and to academic surgeons. We spend an enormous amount of nervous exhaustion on that.
Well, seems as you've again succeeded. Thank you very much, and thanks for your time today.
Well, thank you, Steve. It's been an honor to be here.